Welcome to the Holistic Wealth and Health Podcast. Your co-hosts, Jason Smith and Bryan Bibbo, will inspire and teach you how to prosper in your mind, body, and spirit, not just your financial life. Joining forces with field experts, Jason and Bryan are here to help you focus on what matters most in your life, living well.
Welcome, everybody. I'm Bryan Bibbo with the J.L. Smith Group Wealth and Health Podcast. We have a distinguished guest, Dr. Elaine Husni, Vice Chair of Rheumatology and Director, Arthritis and Musculoskeletal Center. Elaine, great to have you here today. And I know we've connected through the Arthritis Foundation, and we have a great event coming up here with the Silver Spoon Awards on Wednesday, May 15th at the Cleveland Browns Stadium. So why don't you share a little bit about you? How did you get known to be within the Arthritis Foundation? I know your career has a lot to do with it, but share with us your journey, how you've gotten here, and some of those experiences along the way.
Thank you for having me. It's really great to be here. And it's really great to learn about your holistic wealth management. I would love to get some tips about where I should be putting my money as well. So maybe we can exchange some health info for wealth info.
Absolutely.
So I've been involved with the Arthritis Foundation for a long time, probably over 20 years. And that's because I started knowing about what the Arthritis Foundation does back in my training in Boston. So 20 years ago, when I was just sort of fresh out of medical school, the Arthritis Foundation played a really huge role at that time, not so much like I'm more of a speaker now for them and have been blessed with getting some grants from them. But at the beginning, they were a very powerful resource and still is for patients. And I actually connected with them at just a local walk in Boston. They were doing a walk for arthritis that I participated in with one of my patients. And I really got to meet other patients and I got to understand how they were living with arthritis. And I really attribute the Arthritis Foundation to really helping me understand what it's like to live with arthritis.
Yeah, that's great. And I love you sharing that. And when we've met each other and we've talked you have such a passion for arthritis and specifically psoriatic arthritis. And everyone, I like to say, has their unique ability. Like, I love finance, I love the numbers, and that's kind of foreign to a lot of people. But share with me, where does that passion for this come from for you? How did this all start?
Sure. I think many of us that enter medical school, we may not exactly know what kind of physician you want to be, right? So that's the purpose of going through all the different classes and training. You get to find out what your personality is like, where you build relationships with, and what you want to do. The first path is really to separate yourself from medical versus surgical specialties, right? Because they have totally different training. And then as you move on, you really discover, do you want to be somebody that has longitudinal care with someone? You want to be someone that just has episodic care. And these things just evolve over time. And lucky for me, medicine has a wide spectrum of things that we can do. Rheumatology definitely bubbled to the top, mostly because it is a very, I think, problem-solving kind of specialty. We don't really have a blood test automatically for all the arthritis that we diagnose. It's actually clinical diagnosis. So I have to get to know the patients. I have to get clues. I have to understand what their family history is, what they've been suffering with, what their imaging might look like. And I put it all together and we come up with a diagnosis. To me, that's kind of fun. There's many other specialties where if you want to know if you have a heart attack, you take a troponin level. And if it's high, you're leaking cardiac enzymes, you have a heart attack. I want to make it so easy, but we don't have a similar path. Our path is a little different. And I think that's what you're asking me, what's drawing me to rheumatology. That's probably one of the top things that I think of. And I'm a people person. So I like to get to know people. And I really look forward to my clinic where I get to see my patients again and find out what they're doing. And that's probably what drives me in rheumatology.
Yeah, I appreciate that feedback. And I'm much of a people person too. That's why I have the passion, as it sounds like you do too, is sit down with the clients, get to know them, help them. But I think in maybe prior lives or something, both of you and I could have been detectives, right? Because it's really that process of studying what's going on, getting all the clues to the case, and how can you help the people?
I couldn't agree with you more. And then what's interesting is within rheumatology, I have a strong like to inflammatory arthritis. So both rheumatoid arthritis and psoriatic arthritis. And it's been really interesting because when I started in training, I became actually very close to somebody that I was really annoyed with, and that was a dermatologist. Because I said, why does it take a year to get into dermatology? This is ridiculous. You guys need to like step up the game. I need my patients need to be seen. I need to find out if this is psoriasis. So that dermatologist actually became one of my very, very close friends. And we developed a dermatology rheumatology clinic together during my time in Boston, just after finishing my fellowship. So that really honed my interest because I got to work side by a dermatologist. And I really became very interested in the spondyloarthropathies, which is just a fancy name for those that suffer from ankylosing spondylitis and psoriatic arthritis.
Wow. It's crazy to see the story of life of one of your enemies becomes one of your best friends. And when you put both forces together, you can start changing the world for the better. But
Exactly.
I want to get into the most common type of arthritis, which is osteoarthritis, and it affects, from what I've seen, about 32 million Americans nationwide. So, what have you seen? What are some of the onsetting conditions, and how is it affecting people? Does it need treatment? Does it not need treatment? And I know it's kind of a broad question there, but at the end of the day, it's like, what are those conditions, and where does it start to formulate?
Great topic to talk about. I think what most people don't understand is that there's many different kinds of arthritis, right? So one of the problems is filtering the information that's coming at you, especially with AI and the internet, and if you type in arthritis, right? So I think the most important thing is that we do get properly diagnosed because there's just so many different types of arthritis. You mentioned the most common type, which is osteoarthritis, which is wear and tear. So over your lifetime, not to sound pessimistic, but by the time you reach 80 years old, 85 years old, the epidemiologic studies have shown that 1 in 2 will probably suffer some form of osteoarthritis. So it's common.
Yeah.
Does that mean it's going to interfere with your life? Does that mean you're going to have pain every day? No, not necessarily, but you will have some sort of cartilage loss or wear and tear in a joint that will lead to a diagnosis of arthritis. Now, obviously, affecting, a knee joint, an ankle, or a hip joint may affect your walking a lot more than if you just have a shoulder arthritis, right? So the location matters, the number of joints that are affected matters, and then obviously how soon you get diagnosed and how we can help treat it. Some people come to me really early on. Some people wait 20 years before they come see a rheumatologist and say, this knee's been bugging me since I played college football. But you're here now when you're 62. You're like, okay. So we can do it all. But I do want to emphasize that osteoarthritis is the most common, but it's also, there's other arthritides that are out there. So getting properly diagnosed is probably one of the most important things so that you can start your treatment path, right? Because the treatment paths are going to be different between osteoarthritis, rheumatoid arthritis, psoriatic arthritis. So if you don't know what you have, it makes the treatment more challenging.
Absolutely. And for the people that delay to see you, it sounds like that's just a different set of circumstances, but those people have lived with it, right? So if you can live with it, that's always a good thing. But what about wellness strategies? What would be some wellness strategies that people can do that have this arthritis or feeling like they're having? What would you say?
Yeah, that's a really interesting question. Our team has really been trying to understand wellness strategies as it relates to musculoskeletal medicine. I think that with the influx of information we get, you probably don't go through a day where there's not one supplement or food choice that you should be incorporating in your life, right? And then you wonder, like, okay, if there's so many positive and negative foods, what is going on, right? So I think it's very hard to hone into one food. So I think it's a lot about balance with wellness strategies. So I don't think there's going to be a one-hit wonder, like if you eat pineapples all the time, because bromelain is an anti-inflammatory. I think it helps. Whether or not I think that should be the only thing in your diet or predominantly in your diet, maybe we need to kind of talk about balance. So in addition to diet, which just comes to the top of my mind because it's like the number one thing I get asked every week, there's also other things such as movement, exercise, stress management, as well as sleep. So all of those wellness strategy, I think, plays a role in a patient. And unfortunately, it's probably not one sort of wellness book that I can give out. It's probably where are you in that journey and how can I help you get to the movement that you want to have? So I think that just like probably in your wealth management, there's probably not one tax strategy that's going to benefit all. And it's going to be really the devil in the details of, are you a good responder to medication plus wellness strategy? Are you a poor responder and need others? Some people are overweight and need to be a more normal weight, but some people are normal weight and they need more stress management. So I think we are getting much better at trying to address these, but I have to say there's a lack of evidence-based strategies for lifestyle habits, which I think is why many physicians are a little hesitant to necessarily recommend a lot of items until we get to that level of evidence.
Yeah. So what I'm hearing you say, and it's the same thing for us in the financial aspect of things, there's not really that one size that fits all. We always have the what I call the water talk cooler, where you're talking to someone and you hear something, and maybe they're telling you, "Hey, I have arthritis and I'm doing this, this, and this," but that might not make sense for the next person. And the other main takeaway of what I heard you say, which I thought was very important and kind of opened my mind's eye to this, was sleep is involved, stress is involved. We always think about the diet, which is what you just elaborated on, and that's the most common one you hear. But there's so many other factors that play into it. While I'm thinking of those factors, I'm assuming like winters in Ohio affect it, and different climates. Does that also play into it?
Yeah, that's a really common question we get. So, because a lot of people say, Dr. Husney, my joints, I'm telling you, I can tell when it's going to rain. So, I've actually looked deep into this, and most of this is around something around barometric pressures, because that's what changes when the humidity changes. And
Hmm.
because joints are in a very, what I considered closed space, sometimes these atmospheric pressures and barometric pressures can actually make your pain fibers maybe more sensitive. Whether or not it actually causes arthritis, we unfortunately don't have that data. But for sure, the way that we perceive sort of swelling, pain, definitely the mechanical receptors do get stretched out in different weathers. And I think a lot of us know that, like when we get off the plane in cold Cleveland and for our spring break in Florida, and you're like, whoa, and all of a sudden the rings are tight. And so even people without arthritis are having those symptoms. So I can only imagine those that already have pressure in their joints from arthritis when they have these changes in weather, whether or not it's really just their receptors that are changing, whether or not that actually causes arthritis. Unfortunately, we probably don't have that data. But yes, I'm sure weather affects it, but doesn't cause it.
Good. No, I appreciate that clarity, and I see why it's the most common question, but I've never really heard a great answer like that. So I appreciate this. And I want to take a step back about the Arthritis Foundation and how did I get involved, right? I am a sufferer of psoriatic arthritis, and it onset about 11, 12 years ago for me personally. And how I started noticing it, like I was having trouble getting out of bed every morning. My back
Mhm.
was tight. And I use the examples like almost my feet were stone, and it would take my hands to really start operating properly midway through the day. But I bring this up because I want to understand maybe some of the genetics behind it. My mother had psoriatic arthritis at a very young age. Actually, in her teenage years, it started to come out. And her father, my grandfather, had rheumatoid arthritis, and he got that in his early 20s. And God bless him, right? He lived till 89 years of age. So we can live with these things. There's no doubt about that. But have you seen any genetics playing the part or family lines intersecting?
Yeah, thanks for sharing your story. It's a always tough to hear because you have family members with it, and then you yourself is living through this, and it's tough. We don't have a cure for this, but we certainly have so many medicines. I always tell my patients it's a good time to have psoriatic arthritis now than when I was first out of medical school and we only had one or two medicines. Now we have more than I can count on my 10 fingers for different types of treatment. So I think we really have a much better understanding of the different cytokines, which is just a fancy word for proteins that are sort of overregulated in people with RA and PSA. I think the genetics field is really blossoming now because we have the ability to look at the entire genome, which we didn't have before. We now understand things like the microbiome and how your gut might affect some of the genetic components. So I don't think it's as easy as black hair. I'm just going to use my hair for an example.
Yep.
My kids are unlikely going to be blonde. The genetics are very dominant for some of my features, right? So arthritis, unfortunately, is not that clear cut. If your grandfather has it, your mother has it, it doesn't mean that you are definitely going to get one arthritis over the other. It does make you more susceptible. We know that there are both genetic and environmental factors that affect autoimmune disease. And that is an area of great interest and study for many people that I work with. We still have a ways to go. But hopefully that example makes you understand that, yes, there is a susceptibility, but it's not going to be as strong as some of the genetics that many people think about in their sort of day-to-day things that they inherit from my kids, my 3 kids. It's interesting. Anything bad, they like inherited from me. Anything good, they think it's from my husband. I'm like, hey. So I think we still have a long ways to understand this.
Yeah.
But yes, it does play a component.
So I could totally relate to the last comment you made. It's funny. My father will always tell me, "You got those genes from your mother's side of the family, right?" And it's always that, because that's where the arthritis came from, everything else, and that's always getting blamed. So it's funny that you say that about you and your husband and the kids also. But I've been impressed with your work in the clinical studies and the trials, and particularly the precision trial. And it's connecting that cardiovascular events with patients of arthritis. And I thought that to be like outstanding, amazing. That how are those two connected? And can you just elaborate on that for me?
Yeah, thanks for asking about that. That took like 10 years of my life. So the precision trial is probably one of the largest clinical trials we have in arthritis. So it was about 22,000 patients enrolled in over 1,000 sites worldwide. So it wasn't just the US, it was also ex-US sites that we had. And really what we were looking for is a better understanding of a comorbidity, which is a fancy word for other conditions that are commonly associated with rheumatoid arthritis, osteoarthritis, psoriatic arthritis. So that's what the precision trial set out to see whether or not cardiovascular disease, which is a very common comorbidity with these conditions, whether different types of NSAIDs, which are ibuprofen, naproxen, and something called celecoxib. These are 3 different commonly used. Some are over the counter, some are prescription. And the question was, we need to better understand these. Everyone's taking these. Do these have an increased risk? So luckily, we found overall the percentage of cardiovascular outcomes from these 3 NSAIDs were very low in general, and not one had worse cardiovascular side effects than the other. So I think that gives us great pause to say, okay, these patients need relief. We can't be so scared of every medication that we just end up saying, live with it. Good luck. I mean,
Right.
people have to cook, people have to take care of their kids, people have to go to work, and we really have to understand these differences. We can't just have the fear factor. Oh, someone died, someone had cardiovascular disease after taking ibuprofen, and now I'll never do this again. It's very individualized. This study was a huge undertaking, made us really understand that even those patients were enriched for cardiovascular disease, the event rate was just very low. So we need to send that message out, because I think it's more popular or sexy to send out the other message of the 0.1% rather than all the thousands of people that are doing well. So I think if you are monitored by your rheumatologist or your primary care doctor and you're on these meds, I think you can do really well. It's those that take more than you're supposed to, those that don't go see the doctor, those that don't go to get your blood work. That's where it becomes a little bit more dangerous, right? So I think if you are available to, just like brushing your teeth, you see your doctor, you get your lab work, most people do fine. And if we find anything, we stop the med at that time when you usually revert back to normal. But
Yeah.
that's, really important study, and I'm glad you brought it up. And I think comorbidities is very important because many people feel like, well, my joints feel okay, my skin's okay, or maybe I can just decrease my medicine or take it less. But what we want to make sure is that if you're at risk for a comorbidity, like one of those associated conditions, like the heart, we want you to know that because we want you to keep your inflammation levels down. So it's not just about pain and of course improving your joint symptoms, but it's also about the comorbidities.
Yeah. Well, first and foremost, we want to thank you for taking those 10 years of your life of working on this study. And it's really eye-opening for me just hearing it. And it sounds like a lot of those comorbidities play into these other events than necessarily that 0.1%, as we referenced, of the medicine can do and stuff like that. And like you said, it's just a lot of the media, unfortunately, which, hey, that 0.1% is what sells the newspapers instead of, hey, 99% of us are doing great and everything is fine, right?
Yeah. That's an extreme example, but I think you understand the rationale.
Yes.
And just like you do in wealth management, health management is very individualized. And we are every day, I hear Dr. Google, I read, I'm like, okay, let's have this conversation. And I welcome it because I need to know what people are thinking so that we can help. Like we don't have like a set standard visit every time someone comes in with psoriatic arthritis or rheumatoid arthritis. We want to hear from you.
Yeah, everyone can be a doctor nowadays with WebMD and Google, right? But they don't have all the trade in the background. I kid here, but share with me, Dr. Husni, what's new with autoimmune disease, psoriatic arthritis? What are you seeing on the forefront here?
Sure. I think it's like I said, this is really a good time to have rheumatoid arthritis or psoriatic arthritis because you have so many choices. It's kind of crazy. I used to only have to remember one or two drugs, and now there's over a dozen that I have to remember how to use it, when to use it, which insurance, all of those things that play into getting people on treatment. But I think the overall message of what's new is that we understand the pathogenesis of these diseases a lot more than we did 10, 20 years ago. So now we have much more what we call targeted DMARDs or targeted medicines. So we can now specifically target a certain protein. So I think the next sort of wave of medicine is going to be a lot more personalized. So, Mr. Bibbo, if you come in, you're not, and you have psoriatic arthritis, it's not just sort of one size fits all. We're going to try to understand you. We're going to image you. We're going to get blood tests. We're going to find out where you are on the spectrum. And then we're going to carve out several meds that would be more appropriate for you than someone else based on how much skin, how much joints, and things like that. So I think we are looking at a more personalized scope to the way that we're going to be treating autoimmune disease. So that's the new targeted therapy. The second thing in osteoarthritis, which has actually suffered from a lot less therapies, believe it or not, we have a lot more for rheumatoid and psoriatic than we do for osteoarthritis. I think what's exciting in osteoarthritis is the regenerative medicine. So you're going to hear a lot in the news about stem cells, about trying to regenerate cartilage. I don't think we're there right now, which is why many of this is out of pocket. But you're asking me what's new. I think this is a very exciting area. And I think to get properly evaluated and not just to go to other countries to get stem cells, probably not be my recommendation, but really there are very reputable, you just have to kind of filter through, dig through, but very reputable clinics that really do the due diligence in their evaluation for regenerative medicine for osteoarthritis. So I think those are very exciting. And then the third is imaging. I think we are just getting ultrasound, MRI, CT. We are getting very, very much more specific. The resolution is getting better. So I think this is all going to help me both track whether or not your medicine that you're taking is doing well and also to diagnose earlier. And anytime you diagnose earlier makes our lives a little bit easier to treat.
Yeah, I love it. And I appreciate your passion in this industry and also with the Arthritis Foundation. We always ask people if you have one message to leave to the world, what would that be?
So for me would be a lifelong learner, period. So what I mean by that is whether you're in health management, you're a physician, you're a patient living with this. I always want to tell my kids, be a lifelong learner. There is never, I think once you stop learning, you stop growing. And I really think that nowadays we have the advantage of so much information coming at you. And I think always being willing to learn about new things, including myself in rheumatology. We're constantly learning about new things as well. Especially you just mentioned wellness strategies. That's a new learning growth curve for me.
Yeah. No, and you're exactly right. The world is changing, technology is changing, the way we do things, the markets for us are always evolving, changing, whether it be interest rates or just things changing overall. So I appreciate you sharing that with me. Thank you for being part of the Arthritis Foundation. Look forward to seeing you again at the Silver Spoon event on Wednesday, May 15th. And thank you for your time.
Thank you. We'll see you soon at the Arthritis Silver Spoons.
Thank you for listening to the Holistic Wealth and Health Podcast. We hope we inspired you to make changes so you can live your best life. If you want to find out more about what we do, or if you want to have a holistic wealth and health financial plan, please call 456-833-7000. Please subscribe to the podcast and share it widely with your friends and family. Financial planning and advisory services are offered through Prosperity Capital Advisors, PCA, an SEC-registered investment advisor with its principal place of business in the state of Ohio. J.L. Smith Holistic Wealth Management and PCA are separate, non-affiliated entities. PCA does not provide tax or legal advice. Insurance and tax services offered through J.L. Smith Holistic Wealth Management are not affiliated with PCA. Information received from this podcast should not be viewed as individual investment advice. Product discussions and illustrations are hypothetical in nature and will vary based on many factors, including, but not limited to, age, health, product, insurance carrier, and product design. You should consult the insurance carrier website and policy for detailed information. For information pertaining to the registration status of PCA, please contact the firm or refer to the investment advisor public disclosure website, www.advisorinfo.sec.gov. For additional information about PCA, including fees and services, send for our disclosure statement as set forth on Form ADV from PCA using the contact information herein. Please read the disclosure statement carefully before you invest or send money.